Vascular anomalies are categorized into tumors and malformations. This classification, first proposed by Mulliken and Glowacki in 1982, was later adopted and expanded by the International Society for the Study of Vascular Anomalies. Accurate terminology is critical for diagnosis and treatment. Infantile hemangiomas involute and often do not require surgery. Vascular malformations do not involute. Port wine stain is a widely used term for capillary malformation. Lymphatic malformation should be used instead of cystic hygroma or lymphangioma. Infantile hemangiomas. These are the most common tumors of infancy, affecting 4 to 10% of infants by age 1 year, and are more frequent in premature, low birth weight infants. They are 3 times more common in females than males. Location: head and neck 60%, trunk 25%, extremity 15%. Approximately 80% are single tumors. If an infant has 6 or more hemangiomas, an abdominal ultrasound is recommended to rule out large liver lesions that could lead to heart failure. Diagnosis: diagnosis is typically made through history and physical examination. If there's uncertainty, a Doppler ultrasound can confirm high-flow signals. A GLUT1 histological stain is also diagnostic. Clinical course: infantile hemangiomas progress through distinct phases. Nascent, first weeks. A small red patch or visible blood vessels with a pale halo. Early proliferative, 1 to 5 months. Rapid growth of a bright red lesion. About 80% of growth occurs by 3 to 5 months. Late proliferative, 5 to 9 months. Growth slows and the color shifts from bright red to purple. Plateau, 6 to 15 months. The lesion becomes dull purple and grows with the child. Involution, 9 to 36 months. The tumor shrinks, flattens, and the color fades, starting with central graying. Involution is usually complete between 3 and 4 years of age. Residual lesions are common, found in 69% of cases, and can include visible blood vessels, telangiectasia, fatty tissue, thin skin, or excess skin. Prognostic signs: factors like size, gender, site, number of hemangiomas, and subcutaneous elements do not affect the speed or completeness of resolution. The time of involution is indicative of the outcome, and ulceration does not impact the final result beyond potential scarring. Treatment: most infantile hemangiomas are managed conservatively. Treatment is indicated for airway obstruction, for example in beard distribution hemangiomas; visual disturbance, like obstruction, astigmatism; auditory canal obstruction; involvement of vital or aesthetically sensitive areas; painful or bleeding ulcers; large liver lesions causing shunting; medical treatments; beta blockers, for example, propranolol, timolol; propranolol, oral syrup, typically 1 to 3 milligrams per kilogram per day, initiated safely in clinic after 2 months of corrected age. Requires monthly visits and a baseline heart ultrasound. Timolol, topical 0.5% gel solution applied twice daily for superficial hemangiomas. Caution: for large facial hemangiomas, always consider PHACS syndrome, which is an association between infantile hemangiomas and malformation of eyes, heart, major arteries, and brain. Caution before starting beta blockers due to an increased risk of stroke. Steroids, less common now due to propranolol's better safety profile. Intralesional steroids can help rapidly growing lesions with functional impairment. Systemic steroids are a second-line or combination therapy for airway-threatening lesions. Laser therapy, used to improve healing of ulcers and address residual telangiectasia or skin discoloration after involution. Surgery. Urgent surgery is performed during the proliferative phase if the lesion threatens vital structures or function, or if ulceration is painful. Elective surgery is usually delayed until involution is complete, often around early school age. Complications: bleeding, usually controlled with pressure; ulceration, most common, occurring in less than 5% of patients; infection, rare but more common with oral or perianal hemangiomas; High output heart failure, associated with very large liver or visceral hemangiomas. Multiple neonatal hemangiomatosis, high mortality rate, 54%. Skeletal distortion, bones may be deformed by pressure. Emotional psychological distress, can affect children and parents. Education and managing expectations are crucial.